Ashley Vong. So for my case today, I'll be talking about Samantha T, 21-year-old female. We're in the setting of a university counseling center, and her presenting concerns today is she is a junior in college majoring biology with plans to apply to medical school. Over the past year, she's experienced increasing levels of anxiety relating to academic performance, peer perception, and long-term life goals. She reports that the stress has started to interfere with her daily functioning, relationships, and ability to rest. She reluctantly sought help today after her academic advisor noticed a sharp drop in her grades and recommended a visit to the counseling center. With her chief complaint today, she says, "I worry constantly about tests, about saying the wrong things in class, about my future. I can't concentrate and I haven't had a good night's sleep in months. It's exhausting." For her history of present illness, she reports 9 months' history of chronic worry that has become increasingly difficult to control. She describes anxiety as present all day, every day, and says that even small issues such as minor misunderstandings with a professor triggers disproportionate worry and emotional distress. She reports muscle tension, irritability, racing thoughts, and difficulty focusing on lectures or completing assignments. Her sleep is particularly affected, she states. She struggles with sleep onset of insomnia, lying awake for hours while her mind spins through possible worst-case scenarios. She experiences middle of the night awakenings and has difficulty falling back asleep once awake. Socially, Samantha has begun isolating herself from friends and avoids speaking in class due to fear of saying something wrong. She denies panic attacks but describes a persistent sense of dread, apprehension, especially when thinking about her future. She denies any suicidal ideation but says, "Sometimes I just want everything to stop for a while so I can breathe." She denies any substance use, trauma history, or prior psychiatric diagnosis reported. She does report that her mom has a history of anxiety and is currently on medications, and she says her mom is on Zoloft and it currently helps. For her problem list today, I have excessive uncontrolled worry about her academics, social situations, and her future, sleep disturbances such as delayed sleep onset, frequent awakenings, and having trouble to fall back asleep. For her academic impairment, there was decline in grades, procrastination, and difficulty focusing. She reports social isolation and avoidance of social performance situations. Physical symptoms of anxiety include muscle tension, restlessness, fatigue, and irritability. She also has low self-efficacy and perfectionism related to the distress. For her medical diagnosis, I would diagnose her with generalized anxiety disorder. The criteria is met because she's having excessive anxiety and worry occurring more than not for about 6 months now, she reports. Difficulty controlling the worry. She's having symptoms of restlessness, muscle tension, sleep disturbances, and impaired concentration. For my nursing diagnoses, I would do anxiety related to the fear of failure and future uncertainty, as evidenced by excessive worry, restlessness, and difficulty concentrating. I'd also say disturbed sleep pattern related to hyperarousal anxiety, as evidenced by difficulty falling asleep and staying asleep. Ineffective coping related to high performance demands and lack of stress management strategies, as well as social isolation related to fear of negative evaluation, as evidenced by withdrawing from her peers and class participation. For her treatment goals, it would include reduce anxiety daily by 30%, improve her sleep onset and reduce night awakenings for fewer than 2 times a week, increase participation in at least one academic or social group activity. For long-term goals, I would say achieve sustained symptom relief of her anxiety, improve academic functioning and class engagement, develop and consistently use healthy coping mechanisms such as cognitive restructuring as well as relaxation, normalize sleep to 6 to 8 hours a night consistently, and build insight and confidence about uncertainty and her perfectionism. In terms of psychotherapy interventions, I would implement cognitive behavioral therapy. It is a gold standard treatment for generalized anxiety disorder and helps clients examine the connection between their thoughts, emotions, and behaviors. With Samantha, we would focus on cognitive restructuring to challenge and replace her perfectionism thoughts. We would do worry exposure exercises to reduce avoidance and increase tolerance of uncertainty. Behavioral experiments to test her fear outcomes and increase cognitive flexibility. As well as homework assignments to reinforce learning between sessions. We would do this cognitive behavioral therapy weekly over 12 to 16 sessions with progress monitoring her generalized anxiety symptoms, as well as keep record of them. We would also try to implement sleep hygiene, such as strengthening her circadian rhythm, eliminating sleep interfering behaviors such as late night screen use or lying in bed and worrying. For pharmacological treatment, I would offer the patient 25 to 50 milligrams of sertraline or Zoloft daily. I would choose this medication as is a first-line pharmacological treatment for generalized anxiety disorder. It's well tolerated, widely studied, and effective in reducing both the psychological symptoms such as excessive worry or rumination and physical symptoms such as restlessness, muscle tension, sleep disturbances that are often associated with generalized anxiety disorder. In terms of follow-up care, I would advise the patient if she had any thoughts of harming herself or others to tell somebody immediately, well, it's a trusted parent, friend, or contact a mental health professional, such as calling 911, her therapist, or psychiatrist. I would also offer her crisis resources just in case, such as to call or text 988 or to text home at 741-741, all of those which are crisis resources.